Hello everyone and welcome back. Today we'll be discussing a very sensitive and important topic, religion and abortion in Nigeria. We'll look at the definition and different types of abortion. We'll also look at how Christianity, Islam and indigenous belief view abortion, and we will also talk about the causes and effects of abortion in Nigeria. Abortion is defined as the termination of a pregnancy before the fetus reaches viability, usually around the 20th week of gestation in humans. It can occur naturally, that is spontaneous abortion, commonly called miscarriages, or induced intentionally, that's induced abortion. The World Health Organization defines abortion as the termination of pregnancy prior to 20 weeks of gestation, or when the fetus weighs less than 500 grams. There are two main types of abortion. One is the medical abortion, and two is the surgical abortion. Medical abortion requires the use of medication. It involves taking prescribed medicine to end a pregnancy. This can be done at home or in a clinical setting, depending on local laws and medical guidance. This works best in early pregnancy, up to 10 to 12 weeks. The effect of this is that it causes the fetus to contract and expel the pregnancy tissue. Surgical abortion, on the other hand, which can be referred as clinical procedures, requires the use of vacuum aspiration, that's suction abortion, or dilation and evacuation, that's D&E. Suction abortion is usually performed up to 14 to 16 weeks of pregnancy. A suction device is used to remove the pregnancy tissue from the uterus, whereas in D&E, which is often performed after 14 weeks of pregnancy, involves dilating the cervix and removing pregnancy tissue with surgical instruments and suction. There are safety concerns when it comes to abortion. When performed by trained professionals using recommended methods, abortion is considered very safe. It is considered unsafe when done without proper medical supervision and using harmful methods. And this accounts for nearly 45% of all abortion worldwide and are a major cause of preventable maternal death and complications. Christianity in Nigeria is divided into different denominations, and each has its own emphasis on abortion. The Catholic Church, for example, is strongly against abortion right from conception. The Catechism of the Catholic Church states that human life must be respected and protected absolutely from the moment of conception. Abortion is only permitted when the mother's life is at risk. Anyone who commits abortion brings upon themselves automatic excommunication from the church, and forgiveness requires confession to a bishop. Pentecostal churches, on the other hand, also oppose abortion. As odd as it may sound, some individual members and few Pentecostal churches support abortion in the first few weeks of pregnancy. Unlike the Catholic Church, many Pentecostal churches do not have a single universal document on the matter of abortion in Nigeria, but it is registered in their hearts. Those who oppose abortion forbid it as a means of birth control, family planning, sex selection, or any reason of ordinary convenience. The Bible does not mention abortion directly, but passages are often used to defend life. For example, Psalm 139 verse 13 says, "For you created my inmost being, you knitted me together in my mother's womb. This is interpreted as a proof that life begins in the womb and must be protected. Islamic teaching on abortion are clear and nuanced. Many Islamic scholars oppose abortion except when the mother's life is in danger. The Holy Quran in chapter 17 verse 31 states that, "Do not kill your children out of poverty. We will provide for you and them." This verse is often cited against abortion, linking it to the prohibition of killing innocent life. African Indigenous Religion also has strong views on abortion. Traditionally, abortion is not supported, as children are seen as blessings from the ancestors and the gods. Yet traditional healers are known to administer concussion to pregnant women who seek abortion. Oral traditions also warn that abortion brings misfortune or spiritual consequences to the family. The Nigerian law in section 228 to 230 of the Criminal Code makes abortion a felony. A doctor who performs an abortion can face up to 14 years imprisonment. A woman who seeks abortion can face up to 7 years imprisonment. Anyone who supplies instruments or drugs for abortion can face up to 3 years imprisonment. Abortion is legally allowed only when continuing the pregnancy would endanger the mother's life. It is not permitted for reasons such as rape, incest, fetal abnormality, or economic hardship under the Nigerian law. In practice, this has led to many unsafe abortions, as women often seek clandestine procedures when faced with unwanted pregnancies. Abortion in Nigeria is often caused by unwanted pregnancies due to lack of contraceptive use. Poverty and inability to care for the child, coupled with sex selection of a child, especially within marriage, and social stigma, especially pregnancy outside marriage, are causes of abortion. Apart from that, the health risk of the mother and failure of contraceptive also bring about abortion. Among those who support abortion, preventing children who may suffer neglect later in life are one of the reasons why abortions are administered. Apart from that, some women believe that it is their choice and their body to undergo abortion. The common effects of abortion include physical complications such as bleeding, infection, or infertility. Emotional trauma, including guilt, depression, and anxiety, are also examples of the effects of abortion. Social consequences such as rejection by family or religious communities also bring about abortion. In conclusion, abortion is not just a medical issue in Nigeria. It is deeply tied to religion, culture, and morality. Christianity, Islam, and African Indigenous Religion all emphasize the sanctity of life. The debate continues, but one thing is clear: abortion is one of the most sensitive and controversial topics in Nigerian society. Thank you for watching. If you found this discussion informative, please like, share, and subscribe for more content on religion and society.